As Senator Durbin noted, for over 2 decades, I have been evaluating healthcare in immigration detention. I've reviewed autopsies, medical records, death reports. I've interviewed people after their release from deportation and sat with women and men after they were deported. Throughout, I've had deep concerns about the quality of medical care in detention, but I have never been more alarmed than I am right now. As Senator Durbin asked, how is it that in 500 days of this administration, over 50 people have already died? This is the highest rate in almost 20 years, and it is higher than the rate during the peak of COVID. We have been trying to investigate to the extent possible of the scarce data we have available to try to understand what is happening, what is happening that is leading to these deaths. I'll briefly tell you about just one of the people whose deaths we describe in PHR's recent report with Human Rights Watch on deaths in detention. At the age of 4, Ismael Ayala Uribe came to the U.S. from Mexico. On August 17, 2025, Border Patrol apprehended him at the car wash where he had worked for 15 years. They detained him at Adelanto ICE Processing Center. The publicly available ICE records state that at his intake screening, he had no medical problems. Over the following weeks, however, according to his mother, he complained to staff of fever, persistent cough, and growing pain on his left buttock, but he received no evaluation or treatment. On September 21, he was brought in a wheelchair to the detention medical clinic, reporting 10 out of 10 pain. A nurse noted that he described sharp pain near his anus and recorded abnormal vital signs. While a doctor did order pain relief medications, there is no evidence that he had any physical exam to uncover the cause of his pain. 3 days later, Mr. Ayala Uribe was vomiting, sweating, and shaking, all signs of sepsis. Only then was he transferred to a hospital, and there he needed to be resuscitated within minutes of arrival. Hospital staff found a large abscess and scheduled surgery to drain it. But he died early on September 22nd before surgery could take place. The coroner ruled that his death was from a pelvic abscess, and the autopsy showed extensive necrotic or dead tissue spread across his left buttock, hip, and lower abdominal wall. An abscess is obvious on even a cursory physical exam, and it's completely treatable. If it had been treated when he first sought help, it would not have killed an otherwise healthy 39-year-old man. Any clinician would be alarmed by cases like this. A patient should be examined, escalated as necessary, and treated. This is not advanced medicine. This is basic care. Sadly, this is not one bad case. My reviews of deaths under this administration show the same recurring failures in medical care: missed diagnoses, inappropriate care, delayed escalation, symptoms ignored until it was too late. In addition, 7 of these 52 deaths were reported to be suicides. If true, this raises deep concerns about the monitoring and mental health care that people are receiving. Congress requires ICE to count and report deaths in custody, yet we do not know about those who almost died or died soon after being released. For every death, there are untold stories of suffering and harm. Without effective oversight that Dr. Brené will talk about, it's impossible to determine the extent of harms. And yet, oversight mechanisms have been dismantled. Many of these harms violate ICE's own policies. Just one example is the ICE Pregnancy Directive. This states that pregnant, postpartum, and nursing people should not be detained absent exceptional circumstances. Yet in Honduras this past year, with colleagues from the Women's Refugee Commission, I spoke with women who had just been deported from the US, who had been pregnant or postpartum while in detention. They described horrific lapses in reproductive health care. One woman suffered an incomplete miscarriage in custody and received no treatment for 2 weeks. She arrived on a deportation flight near death, suffering again, like Mr. Ayala Uribe, from acute sepsis caused by an untreated infection from the loss of her pregnancy. In closing, Physicians for Human Rights urges Congress to ensure that ICE and DHS conduct a comprehensive and independent investigation of each death within 30 days to learn what went wrong and publicly report on recommended system changes to prevent future deaths. Restore and protect the oversight offices that Congress has mandated. Guarantee that independent medical monitors have unannounced access to every facility. Apply the ICE pregnancy directive. And expand presumption of release to everyone at heightened risk in detention. People with serious medical conditions, serious mental health conditions, with disabilities as well. Mr. Ayala Uribe should never have been ignored while an infection spread throughout his body. The pregnant and postpartum women I met in Honduras should never have been in detention. No one at medical risk belongs in a detention system that cannot keep them alive and well. And each and every custodial death requires a swift investigation. Addressing failures in medical care is not a matter of medical uncertainty. It is a matter of political will. Thank you very much.
Dr. Heisler, thank you for your sharing of that information and, more importantly, for your caring. We really appreciate that.